Okay, good afternoon, everyone. My name is Allie Wells. I'm the Communications Director for the Foundation for a Healthy Kentucky. Thank you for joining Health for a Change, supporting immigrants as a service provider. I've got some really quick housekeeping notes to go over with you all as people hop on the Zoom. If you have any questions during the webinar, you can put them in the chat or the Q&A box. There are no pre-approved CE credits attached to this webinar. However, I can provide a certificate of attendance for joining the full length of today's webinar. The keyword there is full length. I will be able to tell if you exit after only 5 minutes. My email is up on your screen right now. If you want that certificate, please email me at the end of the webinar, either later today or by the end of this week. The subject line should say request for certificate of attendance, and the body of the email just needs to say your name. I'll also include all of these instructions in a follow-up email after the webinar is over. A little bit about the Foundation for a Healthy Kentucky. We are a nonprofit organization funded by an endowment that aims to transform our state so that every Kentuckian has what they need to live a healthy life. Our mission is addressing the unmet health needs of Kentuckians, and our two focus areas are access to care and children's health. We do our work through policy advocacy, we build partnerships and bring together constituency groups, we fund research and data, and we fund and support community interventions and projects to improve the health of Kentuckians. Stop sharing. So we know that health is shaped by far more than what happens in a doctor's office. Whether people feel safe, supported, and are able to access the resources they need all plays a big part. Immigrants in Kentucky face unique barriers when it comes to health and well-being, whether it's navigating a complex health system, dealing with language access issues, or experiencing fear related to immigration enforcement. And we know that service providers often want to do more to help the immigrant community, but they may not have the tools or information that they need. So that's why we're hosting today's session, because improving health outcomes means meeting people where they are. We hope you leave this webinar feeling more confident in your ability to support immigrants who are dealing with those fears and stress about immigration enforcement, because those fears and stress do impact people's health. So now I'm going to turn things over to our speaker today. Angela Cooper is the Communications Director for the ACLU of Kentucky. She has 25 years of nonprofit communications experience, and in her current role is focused on planning, supervising, and executing the ACLU of Kentucky's communication strategies. Angela is passionate about protecting the civil rights and liberties in her home state of Kentucky. Angela, the floor is yours.
Thank you so much, Allie. I appreciate being here. I appreciate being invited to join. And thank you to everyone who has logged on today and taken what might be their lunch hour to learn a little bit about what you can do to protect our immigrant neighbors and community members. I'm going to share my screen here. Okay, so this is Know Your Rights information for providers and honestly anyone who might encounter ICE or local law enforcement. This is my contact information. Feel free to save my email address and shoot me an email if you have any questions after the webinar. If you ever have anything come up where you have questions. I think that it's clear, but I do want to make sure that you know that I am not an attorney. I cannot give legal advice. Nothing in this presentation can be construed as legal advice. And I will tell you that if you encounter something that you think that the ACLU can help with, we have an avenue for you to report that to us. This information is up to date as of today. I did just get a little bit of breaking news that I'll share in a little bit because it does impact the information in this presentation. But the current climate, as everyone I think probably knows, and the status of various lawsuits that are taking place across the country means that anything can change on a daily basis. So you always want to try to verify that you're working with the most recent information to make sure that you're protecting yourself and your patients or clients adequately. So this is what we're going to cover today, a little bit of an overview and the current context and the need for this type of information. We're going to look at Know Your Rights information in general. We're going to look at what to do if ICE appears at your workplace, whether that's a hospital, an office, or really any other service provider. Accompaniment, some regulations that are important to know, how doctors and other providers can help. And I'm going to share some resources after the webinar that I will send to Allie so that she can send them out to everyone who has attended. And that's just a few links on local resources that you may find useful in the course of your work. There seems to be some confusion about this online, which is alarming, but the US Constitution protects everyone. It doesn't matter what your immigration status is, there are constitutional protections for everyone who is on US soil. I am going to have a time for Q&A at the end. I see that there is a question in the Q&A right now, and I'm not going to address that just yet. I'm a little confused about it in general, but I will have Q&A at the very end. So feel free to hold on to your questions. If I do see something pop up in the Q&A that I can address immediately, I will. So March 10th through March 14th, we had Operation Take Back America. During that time, there were no known raids in Kentucky. ICE conducted Operation Take Back America during these dates, and according to their own press release, 81 people were arrested. They were from Mexico, Guatemala, Honduras, El Salvador, Cuba, India, and Palau. 25 were charged with immigration-related criminal offenses, which was primarily just reentry after deportation. The federal agencies involved were those listed in this slide. So as you can imagine, that is an enormous effort, an enormous cost to the taxpayer to arrest 81 people, 25 of whom had, come back to the country after deportation. So that's how a lot of this began. Prior to January 20th, there were absolutely no law enforcement agencies with these specific cooperative agreements with immigration. So Section 287G agreements basically allow the federal government and ICE to deputize a local law enforcement agency. For example, if a law enforcement agency wants to assist ICE, apparently they can do that. They enter into this agreement with the federal government and they can perform certain activities. It does not make them ICE agents. It does not make them federal agents. It just allows them to be a cooperator with those efforts. As of June 11th, I was not able to update this list today, but these are the counties who have 287G agreements with ICE. I'm not sure if Heritage Creek has signed theirs or not. But these are all of the folks who have signed up and said that they wanted to support ICE with their local police departments. You can find this information online. It is public. It's public knowledge. The public is entitled to know which law enforcement organizations have entered into these agreements. So they are posted on the federal government's website. I believe they're on ICE's website. If you just search 287G, you can find out what the current list is. So these are the things that a 287G agreement allows. So they can interview, they can check the DHS database, they can enter data into the database, they can issue notices to appear, they can make recommendations for voluntary departure, which I suppose someone could take or leave since it's just a recommendation. They can make recommendations for detention, and they can transfer non-citizens into ICE custody. They would have to, of course, determine first if those folks were non-citizens. So the no sensitive areas policy existed to protect certain places like churches, schools, hospitals, from immigration enforcement actions. The idea behind that policy was that these are sacred places. Everyone has the right to an education when they are in the US. Everyone has the right to go to church and worship. Everyone has the right to receive medical care. So ICE was prevented from entering those places for purposes of detaining and deporting people. January 21st, the Trump administration rescinded those policies. And now ICE agents can go into those places. So it is not illegal and is not in any policy violation for them to enter those places. We have had reports of attorneys and social workers who have seen plainclothes ICE officials in county courthouses all over Kentucky. Sometimes they are looking for someone specific. Sometimes they're just there to arrest anyone that they come into contact with who can't immediately prove their immigration status. These are the things that you can do to protect your patients and yourself. Like, these are things that honestly anyone who has the ability to do these things. And I do want to recognize that these recommendations come from a place of privilege, right? I can't remember how much it costs to get a passport, but it was like $100 the last time back when I got my passport. So not everyone can afford to do that immediately. But everyone can make a preparedness plan. Make sure you're getting your information from trusted sources. Consider getting a power of attorney if you have minor children. Again, this is, if you can afford to. There are a lot of resources available. There are folks who have come together and created organizations like the Louisville Coalition for Immigrant Support, LCIS. You can read more about them on the ACLU's website under coalition work. They have brought a bunch of different organizations together so that they can, I'm so sorry, I can't make my phone hang up without, there we go. I'll just turn it down. They've brought all of these organizations together just to support the immigrant population during this time, because things are really scary right now. And we're seeing things happen without due process, which is incredibly frightening. Because if it can happen to the people who you see taken away on the news, it can obviously happen to anyone. So to the extent that you can, and the extent that you can recommend that your patients and clients do, make a preparedness plan, consider a special power of attorney, get a passport, and find safe places to be in community. These are the rights that patients have under federal law as it stands today. So the EMTALA, which is the Emergency Medical Treatment and Labor Act, ensures that everyone, regardless of immigration status, is entitled to receive emergency medical care. Before the Trump administration started these mass deportations and causing all of this chaos and confusion, we had at least one instance, and probably more in Kentucky, of what was called medical deportation. There was a man who I believe was in a coma, and it's been a while since I looked at the details of the case. He was at U of L Hospital. They were attempting to transfer him to his country of origin at a time when he did not need to be moved. It was not in his best interest to move at all, be taken away from his family while in a coma with no recourse. The family sued, and they were able to keep him here so that he could continue to receive the medical treatment that he needed. But that was something that, while the hospital said, oh, that's not something that we do, it was at the time. But EMTALA, as of today, still protects everyone, regardless of immigration status. They are all entitled to, everyone is entitled to receive emergency medical care. And then, of course, we have good old HIPAA. which I certainly appreciate, and I know a lot of others do, which limits information that can be disclosed without patient consent, and that includes federal agents. They do not have the right to look at patient medical records for any reason without a signed judicial warrant. This is the Know Your Rights information. We have this information on our website, so please bookmark this link, go to it, take a look around. There are Know Your Rights explainers for a variety of different situations. The two key Know Your Rights sets that I want to talk about are Know Your Rights when talking to law enforcement, which covers immigration and ICE. And then Know Your Rights when protesting, I want to talk about as an aside, just because of some recent activity that we've had. So knowing your rights when talking to law enforcement. You always want to make sure that you stay calm. We never want to escalate these situations. So if you encounter law enforcement who are asking about immigration status, either yours or a patient's, or family members, you want to stay calm, and you always want to exercise your right to remain silent. Talking to ICE, talking to police officers is a really great way to give them a reason to detain you. So the words are generally, I'm exercising my right to remain silent. And that's where it ends. The only thing that can compel a person to interact with an ICE agent is a signed judicial warrant. It has to be signed by a judge. Without a signed judicial warrant, which is different than like an administrative warrant that comes out of the ICE office and can be signed by a supervisor, without a judicial warrant, you do not have to interact with ICE. You do not have to allow them access to your person, to your home, to anything, unless they have a signed judicial warrant. This is something that has not been shared as widely, I think, as other advice when interacting with ICE and law enforcement, but it really is key to due process. This prevents agents from arresting people who they have no business arresting or even interacting with, because they have to at least have done their due diligence and obtained that signed judicial warrant first. So please bookmark this page. I also have printed immigration Know Your Rights cards in 6 languages currently. I can distribute small numbers of these to folks who are interested in having them. If you want to have them in your office, I can also tell you where to order more. We have a limited budget and limited capacity, so I order as many as I can and share them with folks who are doing work in immigration spaces. And I'm happy to do that for people on this call who are interested in obtaining them, or just finding a way to facilitate having these cards in your office spaces. The languages that we have them in are English, Spanish, French, Swahili, Kinyarwanda, and Haitian Creole, which are 6 of the most spoken languages in the Commonwealth of Kentucky. Swahili is 3rd. It's English, Spanish, and then Swahili, which was a surprise to me. We have a very large African immigrant population. Oh, I see this question about information on the number of people who are deported without due process. That is not information that I have, particularly since I don't know if anybody is tracking that number. I'm sure that someone is. The National Center for Immigration Law might be a good place to start on that one. You can also check out National ACLU's website, which is just aclu.org. They have been tracking a few metrics like that, but I'm not certain that that number, I'm not certain anyone has that number. And of course, there are people who have been detained or sent to facilities that we haven't found, where we don't know what has happened. Looking at this, how can we reinforce the protections offered by the U.S. Constitution, even when professionals sometimes struggle to interpret it, and ensure that vulnerable communities understand and trust those protections? That's a really great question. It's a really great question, and it's a really difficult one to answer. Constitutional law is complicated. Um, we have to rely on the courts when it comes to interpreting the Constitution. We have to rely on attorneys. I certainly, it is difficult to interpret. It's not written in a language that we really use anymore, and some of the words are open to interpretation. We have to rely on court precedent. And then I certainly encourage anyone who feels like their constitutional rights or civil rights have been violated, particularly in the state of Kentucky. Again, go to our website. Under the legal section, there is a button that you can click that takes you to our form, which is a request for legal assistance. We get hundreds of them a day, but we do read every single one of them. Due to capacity, we do not respond to every single one, as I'm sure you can imagine. But our attorneys do look at all of them, and they do respond when they feel like there is something that they can help with. There are other times when, things like this come up, and I'm asked to do a presentation as a layperson who is not an attorney, but who is a communications expert. And we try to do those things as well and just sort of spread the word. Sharing the cards is really helpful. We noticed in the beginning of all of this that a lot of the Know Your Rights information that was being disseminated didn't mention the signed judicial warrant. And that is so key that it was alarming that Know Your Rights information was going out without this information on it, including some of our older Know Your Rights information. So we updated that as quickly as possible to make certain that people have the most current information and know how to protect themselves. This is what I was talking about with the signed judicial warrant. So there are two different types of warrants on this slide. And these are the things that you want to look for. So a judicial warrant is the one on the left. That is the one that is from a United States District Court. It's obviously not going to say California. Kentucky has an Eastern and Western District, so it might be from one of those, but it has to be from District Court. You want to make certain that the address is correct. You want to make certain that that date is correct. That is it still current date is key. If someone is walking around with a really old warrant, it's entirely possible that that warrant's already been served. The person has already taken care of whatever that warrant was associated with. So the date has to be current. And then you want to pay very close attention to attachment B, which has the list of the person, the property, the areas that may be searched. So you want to be very careful about what those things say and make sure that you limit access in that way. You want to make certain that it is in fact signed by a judge. Obviously, things can be forged and that sort of thing, but it is highly unlikely that you're going to come across a warrant that looks like this that isn't a signed, a judicial warrant, as long as it has the signature and as long as you can answer yes to all of these things. The immigration warrant does not compel you to interact with ICE, and this is something that you might see more often, might see presented as a warrant to allow access to a business, to a home, or to search a person. And that is not, this warrant does not cover that. For purposes of our discussion today, this warrant is relatively meaningless. It does not give the officer or the person who is presenting it any power. And I will share these slides so that folks have all of this information. So this is what to do if ICE is waiting for one of your patients. I'm going to answer another question live here in just a second. So remind the patient or client of the right to exercise the right to remain silent. Again, that is absolutely key. Staying silent is one of the best ways to protect yourself. And asking for an attorney should be pretty much the only thing that you say. As it says on the slide, answering questions really only helps ICE to move the deportation process along. You want to determine whether ICE has a judicial warrant, and you want to be certain that it is signed by a judge and not just an ICE supervisor. You want to get as much information as you can from the officers, asking for their names, their contact information. You want to ask them the basis of the arrest. You want to ask if they have a judicial warrant. You want to ask to see it, and you want to ask where they are taking your patient or client if they are attempting to detain them. If they refuse to answer these questions, if they cannot answer these questions, no one is asking you to have a physical altercation with an ICE agent, but you do want to record and write down as much as you can. If you write down as much information as you can get, write down everything that you can possibly remember. You can record with your phone if that is something that you are willing to do. Obviously, you want to protect yourself and stay safe and only do what you're comfortable with. But at this time, there is absolutely nothing that prohibits you from recording, particularly in your own place of business. You want to document what happened and report the arrest, even if you didn't witness it. So again, just information gathering, writing things down as soon as possible so that they're clear in your memory. The who, what, when, where is all incredibly important. And you want to note how the officers identify themselves, how they respond to a question, and when you asked them for a warrant, note how they responded. Okay, couple of questions that I'm going to answer live. As a business, do they have to have anything to come in? The answer to that is no. ICE agents can enter any public business and they can view anything that is in plain sight. However, if you have an area of your business that is designated staff only or employees only or patients only, they cannot enter those spaces without the signed judicial warrant that specifically says they can enter that space. So if the general public can walk in and see something, then ICE can walk in without having any type of warrant or anything else. Beyond that, even if it's just a handwritten sign that says staff only, employees only on a door, they can't go in there. Or past a certain point, if there's something that says like employees only past this point. Any place the public is not allowed to just wander into, ICE is also not allowed to wander into. There's a question about asking these questions if there is a language barrier. I have on my desk, so you can get red cards. And if you just Google free red cards, there are folks who will ship them out to you. They ship them out for free to nonprofit. Businesses can buy them for a very reasonable amount. It is literally just a card that says, I don't want to talk to you. And it has like a little bit more information on it that people who have a language barrier can use. Asking these questions if there is no one present. So if there's no one present who speaks English and can communicate with the officer, then they have to find an interpreter. That's the onus there is on ICE or on the agents to find an interpreter who can communicate with the person that they are speaking with or the person that who they are trying to detain. And they are required to provide that. Now, I, like anecdotally, personally have seen videos of ICE taking someone off the street who clearly did not speak any English, and they couldn't ask them any questions because ICE was not responding. They literally just took this person. And when that happens, my advice is to report it to the local police the same way that you would a kidnapping, because that's essentially what you have witnessed. Another question I'm going to answer live. I've heard that some ICE agents have presented random papers found on the street or unofficial documents and claim they were warrants. Yes, that is true. I don't know about the found on the street part, but I do know that unofficial documents and things like the administrative warrants, I know that agents have presented as if they are valid for detainment. They're not supposed to do that, but in this current climate and in this administration, there are a lot of things that are happening that are not supposed to happen. There are a lot of things that are happening that subvert due process. There are a lot of things happening that are just flat out illegal. I've had people ask me, what do I do when someone is just like disappeared off the street? And it's a really tough question to answer because certainly as the ACLU of Kentucky, we do have to rely on the courts. So my advice would be to report it to local police, the same way that you would any other crime, and to fill out our request for legal assistance and tell us what you've seen. At least that way we have a record that something happened. Taking video is always incredibly helpful. Another question I'm going to answer live. If I keep my business front door locked in general and people ring the doorbell to be let in, do we need to let ICE in if they don't have a warrant? The answer to that is no, you do not. If they don't have a warrant and they don't have an appointment and your business is, say, by appointment only, and you only open the door for your clients, then you are absolutely not required to open your door for an agent that does not have a signed judicial warrant allowing them entry to your business. And another question, who do we report these findings to? If we do interact with ICE, again, please write us and let us know. Contact local law enforcement, even if local law enforcement is not friendly, or if local law enforcement has a 287G agreement and you assume that they're going to be on the side of ICE, they still have to take the report. They still have to creates a paper trail, which is at least somewhere to start. And that's kind of where we are in this moment, where sometimes you just have to find like something you can do. Okay, we went through this slide. How am I doing on time? 12:30. Okay, we're good. So this is advice on what to do if they do show up at your office hospital. So this addresses the question about keeping the business front door locked. You want to ask the personnel to identify themselves and ask them whether they have a legal basis to enter. If they cannot say, yes, we have a legal basis for entry and we have a signed judicial warrant, they can't come in. You can deny entry. You can say, no, I'm not going to allow you in here. When a lot of this first started, we had a lot of scared parents who were worried about sending their kids to school. And Jefferson County Public Schools put on their website, they're not going to allow ICE agents to come into schools. We heard that it happened anyway. And there are times when like there isn't anything that you can do, but it's best to just be as prepared as possible, to have a plan and to know what you are going to do if. And of course, you can't plan for surprises. You can't plan for someone acting outside of the law. No one can plan for that. If they do have a legal basis, you want to look at the documents that they've presented. You want to make copies of the documents that they have presented, and you want to send those copies to the hospital's attorney to review. And that way you have legal representation. So if this is a hospital, if it's an office, if you have a general counsel or that kind of thing, obviously, if you're a small business owner, or you don't have like hospital, if you don't have that type of relationship with an attorney, it's going to be a little bit different. In those cases, I would recommend reaching out to LCIS, the Louisville Coalition for Immigrant Support. If you're in Louisville, statewide, the New Americans Initiative is doing really great work in immigration, and they have been incredibly helpful, and they were started and are staffed with several attorneys who are very familiar with immigration law and very familiar with the current climate as it relates to immigration law. A lot of the information for this presentation is honestly a joint effort by the New Americans Initiative and the ACLU of Kentucky. We have just shared information. They have a lot more of the current, this is what's happening on the ground right now, because that is literally their focus. Their focus is on immigration. We, of course, have several issue areas that we follow, which limits our capacity. So the Know Your Rights information comes from us. And then a lot of the information that I've shared with you about what is actually, going down in Kentucky right now has come from New Americans. So they're a really good resource. And another place that you can report things to if you have an interaction with ICE, which is why it's great to have copies, because that way you can send it to everyone. If you have connections in the media and you see something that you think is subverting due process, it's always, well, not always, but it's not a bad idea to share those things with the media as well, so they can let people know what's happening. This is a section that is important for really anyone. The section 1324 is part of the US Code. It's a federal law that criminalizes several things that someone might do to try to help another person come or stay in the US without authorization. It can include fines, it can include imprisonment. This is basically like actively trying to hide someone who you know is attempting to avoid ICE. We are not asking and would never ask anyone to do that, to put themselves in jeopardy in that way, but there are a lot of things that you can do to make your community, your workplace, safe for immigrant populations without running afoul of Section 1324. These next few slides are examples of things that you can do, things that you can participate in to support immigrants' rights. And these all steer clear of potential, I can't speak today, criminal liability. For example, if you adopt a policy of non-discrimination at your workplace and you just say it is our policy to welcome and help people regardless of their immigration status, citizenship status, race, ethnicity, all of these things, and make a public statement or have a public posting of that policy, that protects you, because you can say this is our policy for anyone. It is not specifically just for the immigrant population. You can also adopt a privacy policy, which is something that we at the ACLU take very seriously. So we would never ask someone about their immigration status any more than I would ask someone about their sexual orientation, or expect someone to donate and give us their credit card information and share that information with anyone, or even view that information myself. So if you have really strong non-discrimination and privacy policies, then you're protected there as well. These are things that we can do to help just as humans. Any services that you can provide, volunteer for organizations that provide, doing all of these things is helpful to the immigrant population. It's helpful to the houseless population, which has increased in the last year in Kentucky. So there are plenty of places who are in need of volunteers and people to support their services. And this is direct service that you can provide just to help people out. And there's always, always, always a need. And speaking out, attending a webinar like today is something that you can do to help the immigrant community, in educating yourself, informing yourself, making sure that you have the latest information, and telling people that you believe immigrants have rights, and expressing support for those folks really goes a long way to tell lawmakers that the people of Kentucky, the people of the United States, are well aware that diversity is a strength, and diversity includes immigrant populations and refugee populations. Again, you would never ask someone's immigration status, but referring people to the legal assistance resources, having Know Your Rights sessions. We are trying to, at the ACLU, we're trying to organize a little bit so that we can have more of these, so that we have more capacity to do them. I have colleagues that I'm training and sharing this information with so that they can disseminate it to others. And then we're hoping to train some volunteers to be able to give these presentations as well. So if you know someone who needs to host a session like this, or would like to host a session so that you can invite folks, please let me know. And I will continue to do them as long as I have capacity, and hopefully we'll be able to expand that as well. There's another question that I am going to answer live. I noticed the last slide mentioned about not notating their immigration status. Is it not a good idea to document a chart note about a client who is in the process of seeking asylum? I mean, if the client volunteers that information as part of your interaction with them, and that is something that is pertinent to your work with them, I don't see any problem with documenting that, because if it's a patient chart, then HIPAA is going to cover that anyway. And ICE has absolutely no recourse for looking at a patient chart in any situation. If it's not pertinent to your work with them in any way, then I don't see the reason for noting it. I'm not a medical professional, so there could be things that I'm not seeing here that that make sense. But you can also note things in a different way. Like instead of specifically saying this person is an asylum seeker, you could say like referred to NAI, referred to the New Americans Initiative or something like that, or provided resources on or something like that. That is certainly up to your discretion. And if they volunteer that information, then I wouldn't worry about it at all. It's the other slide is more like, don't ask people unless they're telling you. It makes people uncomfortable, and it's really scary right now. So if it's not information that you need to have to treat them or interact with them or provide whatever your services to them, then there's just no reason to ask. This is very heavy. And I don't have I have a little bit of experience with forensics, but this is a training. I don't know who offers it right now. It is probably one that someone at NAI could point you to. But getting trained in how to conduct forensic evaluations that can be used as evidence could certainly be helpful. It's something that I would hope that no one would ever have to do, but we know what world we're living in right now. So this is just kind of where we are. This is a specific form, again, not a medical professional and not aware of the specifics of this form, but there is a medical certification for disability exceptions. So that can help with folks who are attempting to obtain citizenship. This sort of exception where they are excused from some of the activities that are required to become a citizen because of their medical status or psychological status. Drafting letters of health conditions can be incredibly helpful for folks who are seeking asylum. They can also be useful in bond hearings. There's a lot of judicial discretion when it comes to bond hearings. Having representation is always the best thing, for someone to have an immigration attorney. At the ACLU, at the ACLU of Kentucky, we are not immigration attorneys. We do have some at National, and there are other affiliates who keep immigration attorneys on staff because that is a larger part of their work. There are a few clinics across Kentucky. I am sure that if you are in the Lexington area, you have heard that Maxwell Street will be closing, which is devastating. I believe that I can share that all of the clients who are currently involved in some sort of case where they are represented by Maxwell Street will be able to keep their attorney. There are some details of that I don't think that I am at liberty to share, but those folks will be protected. It is still an enormous loss for the community just to not to have that resource. So capacity is really an issue. There aren't that many immigration attorneys. It's not a particularly lucrative area of the law to practice. And it's very frustrating, and it's very difficult, and it's very complicated. So there are a limited number of attorneys in Kentucky who can do this work. If someone gets to the point where they need representation, they should be able to find someone. Again, that's something that NAI can help with. And I have a few other resources that I'll share in the post webinar. But yeah, it's not a great situation that we're in right now. let me look at this other question. Civil surgeon who does immigration medical exams for people who are trying to do an adjustment of status. Is there anything you can do to keep people safe? Oh, and you don't need special training. Again, I would verify this, not that I don't trust you, Dr. Villasis, perhaps. This advice is to just be careful about checking the boxes on the N648 exam, that you don't need special training or approval. As far as anything that a civil surgeon can do, you do need, okay, I'm not going to dig into the which ones you need approval for and not, because I think that that's probably a little more in the weeds, and I am certainly not a medical expert. Anyone who is interested in performing these different exams that have to do with the federal government or is a civil surgeon, I think, you know where to find out which are, which you need approval for and which you do not. As far as things that you can do to help keep people safe while doing immigration medical exams, it's really just going to be asking the questions that you probably already asked. Asking about people's mental health, asking, just how they're doing in general, asking if they have access to Know Your Rights information, and having the Know Your Rights information on hand to share with them is incredibly helpful. Those are all of my slides, and we're right at 12:45. So I am happy to spend some time looking through questions. I am going to ask Allie to help facilitate that a little bit because I haven't done a Q&A in Zoom in a really long time, if you hadn't noticed.
Yeah, we've been getting a lot of questions. The engagement
Okay.
has been great.
Great. I'm glad to hear that. Thank you all. There's an anonymous question in here that I'm going to read out and try to answer if I can. As a community engagement specialist working with immigrants and refugees, what are the most effective ways to educate families who are fearful or uncertain about Medicaid while also ensuring their children's health and safety and rebuilding trust in our outreach efforts? That is a huge question. It's a wonderful question, and I'm really glad that you're asking it. Maintaining relationships with the communities that you're working with is always going to be key. Showing up, honestly, it's just being really consistent, making sure that the community members that you're working with are seeing the same faces over and over again. There is a level of distrust for everyone, and like, can you blame people? It's a terrifying world to live in right now. So consistency is very key. I think that having things like printed Know Your Rights cards that have the ACLU's logo on them, that are branded with just because we have such a strong brand and people do know that it comes from experts and that it can be trusted. So having that kind of information on hand that is branded by a national organization or a local organization that is very well known and trusted is very helpful. Everyone is worried about Medicaid right now. I am a former Medicaid recipient. I had my child as a teenager. He relied on Medicaid for most of his childhood, and I relied on it during my pregnancy and after. I love Medicaid. It's a wonderful program, and what's happening to it is really terrifying. And I can't imagine being undocumented on top of that. So it is incredibly scary. I encourage providers to do what they can. Clearly everybody needs to be paid to do their jobs. And, if Medicaid reimbursements stop coming through, it's going to impact a lot of people in a really horrifying and life-changing way. I just encourage you to do what you can, make referrals when you can, and to continue to provide service for as long as you can.
There's one question in the chat, Angela. Someone who's got a family member who's a green card holder, currently out of the country visiting her family, but she's concerned about the coming back into the country. Is there a danger of her children being separated from her? Do you know anything about that?
That is beyond what I have any personal experience with or have heard about. I would just encourage always keeping the green card with them, making certain that they always have their papers on them, making certain that their children have some sort of identification, even if that means like just getting like a state ID or, something where you can say, this is absolutely my family member. This is absolutely someone that I am related to. Here's proof of both of our um, identities. So that you at least have that layer of protection that is something from the government that says this person is who they say they are. I have heard, again, this is anecdotal, but I have heard, of folks who did not have their green card on them being detained. So I can't emphasize enough how important it is to keep that documentation on you. I am the whitest of white people who is the descendant of really white people, and I keep my passport on me just in case, because there's just absolutely no way of knowing. There is another question here that says, how about children born here in the US but not the parent? Would the child still be a US citizen? As of today, the answer to that is yes. A federal judge has stopped the birthright citizenship nonsense that the Trump administration has been perpetuating. So currently, birthright citizenship is still the law of the land. Unfortunately, with the courts being what they are, we don't know if it's going to stay that way. But as of today, as of this moment, a person who is born here, whether their parents were born here or not, is a US citizen, full stop. There's the breaking news that I referred to for those of you who are located in Louisville is incredibly upsetting and unfortunate. Apparently, Bondi has issued a memo to 500 cities, including the city of Louisville, strongly advising that we drop any policy that prevents the Louisville Police Department from entering into a 287G agreement with ICE. So it sounds like after today, LMPD will be free to enter an agreement should they choose to do so. It threw me off a little bit at the beginning of the presentation, and I apologize for that. It's deeply upsetting, and LMPD has a history of some not great behavior, so it's going to be really. We'll have to keep a close eye on what happens moving forward. Thank you, Emily, so much for the thanks that is in the chat. I really appreciate that. And there's a request for my contact information. I am happy to drop my contact information. Or actually, Allie, would you mind putting my contact info in the chat? Just my name and email address and title.
I can do that.
Email. Thank you so much. Email is the best way to get a hold of me. My inbox stays full, and it might take me a day to get back to you. But it is the best way to get a hold of me right now. I used to be a zero inbox every day person, and I am no longer that person. It's very sad.
And we will be sending out a link to the recording from today and the slides and all those resources. So all of that will be included in that follow-up email that you all will get.
And I have some links that I'll share with Allie to include in the follow-up email as well, to NAI, to another resource list, to LCIS. And there's another support group in Lexington that I'm forgetting, and there are some that are in other parts of the state that I just can't remember. We're also in the process of building a resource list on the LCIS page on our website. So if you want to bookmark that and check back on it in probably 3 weeks or so, maybe, we're doing some outreach so that we can build a really comprehensive list of services and people who are working with immigrant populations right now. And that is 100% led by LCIS, which the ACLU is a member of. But they're doing really amazing work at doing exactly what I was talking about in making connections, building trust with communities, and finding resources for everyone that they possibly can. There is an anonymous question that says, my son was born here, but I'm Mexican and a US citizen. Should I send him a certified copy of his passport? I would. again, not an attorney, not legal advice, but it certainly cannot hurt. I would err on the side of overprotection in cases like this. That is my advice. If that is something that you are able to do and it's not going to be a massive hardship, then yes. And there's one more in here about a policy from Housing and Homeland Security. New policy bars many lawfully present and undocumented immigrants from a broad range of federal health and social supports. I don't know a lot about that policy because this is the first that I'm really seeing of it. It's certainly not surprising. And we know that this administration is going to continue to attack organizations that support immigrant populations, much in the way that they have been attacking organizations who support LGBTQ populations. We've seen the attacks on trans people. It is all part of the same playbook, which is to other anyone who is not a straight, white, blue-blooded American, and shift the blame for everything that has gone wrong in anyone's life to them. And we know that's not the case. We know that it's these are policies that are born out of ignorance and fear, and a desire to retain power for white patriarchy. I mean, like it sounds like I'm teaching a women's studies course at this point, but that's essentially where we are. It's unsurprising when any of these policies are announced because this administration is already doing so many things that are just like patently unconstitutional and illegal. So my advice, that is again not legal advice, is just to don't comply in advance. It's really, these are the things that these are the things that a fascist regime does to test the waters and see how far they can push people before people will push back. And we're seeing a lot of pushback. We're seeing those protests, and there is Know Your Rights When Protesting information on our website as well that I encourage you to print yourself and have if you're going to engage in protest activity. It's pushing to see how much they can do without people revolting, honestly. So my stance and the stance of a lot of the folks who are in situations where these policies impact their work is, until somebody specifically says you cannot provide this service to this person, and like here's the consequence, then I'm going to keep doing what I'm doing. That's I've seen organizations go both ways as far as nonprofits, and we've seen like Maxwell Street, they lost some federal funding and couldn't keep their doors open. And the reason for losing that federal funding was 100% because they provided services to undocumented immigrants, and they were the only nonprofit law firm in the state who could, because legal aid is prohibited from doing any work for undocumented immigrants. So if you cut off all of the supports, cut off all of the resources that people can access, then it is just going to be easier to push people out of the country who you think don't belong there based on racism, bigotry, and ignorance. But let me tell you how I really feel.
We are, unfortunately coming up on time.
Yeah.
We had so many great questions. Thank you all for being an engaged audience. It was really great. Angela, thank you so much for that incredibly insightful information. Thank you for the time you put into putting together the presentation. Like I said, I'll be sending all of it out in a follow-up email, so you all will get all those resources. So be on the lookout for that in your inboxes. With that, I hope you all have a great rest of the afternoon.